Okay, good evening, everyone, and welcome to the December 16 Georgetown Select Board meeting. I'll call the meeting to order at 6:01. We have a few folks in the office with us, including our presentation by Walter, Gert, and Chief Whalen on hand to answer questions as I understand it. And with that, I guess we'll go right into, first, before we do public comment, are there any items to be added to the agenda, Katie?
No.
From your perspective?
Not
Anything from y'all?
No.
Okay, great. All right. And now we'll handle public comment. Do we have anything from Mr. Knaber or Mr. Gravino or Mrs. Gravino? No. Okay. Anything from y'all? Okay, great. Anything for those of you attending online? Not seeing anyone. We will jump ahead and let's start sharing that screen. We've got Mike McDermott in the waiting room. We're gonna let Mike in. And we are ready, 3 minutes early. Gert Walter. We'll get this queued up to go here in a moment. All right, take us away, please.
You go to the next one. So I'm going to talk tonight about this proposal that's been presented before, but has apparently been turned down in the past, but I think it's time to revisit it. Then the proposal is that Georgetown Fire Department bill insurance companies for all patients who are transported by the fire department. And this is really a key concept of why I'm bringing this forward here. Georgetown needs to stop subsidizing insurance companies at the cost of our taxpayer dollars. So the presentation here is going to be explaining how we do this and why. Okay. So these are just my credentials. I'm an emergency physician. I've been board certified over 40 years, still work up in Holton, up near the Canadian border. Kathy, my wife, and I moved from Georgetown 2 years ago, but we've been in West Bath for 23 years. And my EMS career started, I won't say how long ago, but during residency, where I won a national best poster presentation for an EMS issue. When I was working at St. Mary's in Lewiston, I was there for 8 years. I was a chairman, and it was also co-chair of the United Ambulance Service in Lewiston. It's a service that's run by both hospitals there. Used to be, I don't know if it still is. During that time, I was also a member of the Maine EMS Physicians Advisory Board. This is a group of 6 or 8 physicians who advise the EMS community in the state at the time. Then when I moved to Massachusetts, I was medical director of between 7 and 14 EMS services, both BLS and ALS, around the Emerson Hospital in Concord, and was doing that for over 25 years. I retired from there last December, so just about a year ago. Okay.
And Gert, in case people, I heard you say you moved from Georgetown 2 years ago, but that's probably my poor hearing. You moved to Georgetown full time.
Moved to Georgetown. We're here full time.
Thank you.
So this is just how this program would work. When somebody calls 911, the dispatcher answers and Georgetown Fire Department responds. So sometimes it'll be a call for wellness check. Somebody's father lives in town, they don't hear on the phone, they call 911 to check on him, and the person's fine. Or maybe there's a motor vehicle crash, there's somebody hits a tree and a bystander calls 911. The fire department responds and there's a fender bender and the person's outside the car waiting for a tow truck and they're completely fine. So those people would not go to the hospital and there would be no bill generated for those people because there's not a transport. The ambulance didn't actually go to the hospital. This is another example here. Dispatch gets a call, Georgetown Fire Department responds, and the patient's transported to Midcoast. And the fire department has multiple levels of providers, both at the BLS intermediate and the ALS, the advanced level. So sometimes depending on who's staffing the ambulance, sometimes depending on the call, it would be at different levels and the billing would also be different. Then since the patient's transported, the patient's insurance company is then billed. Now, this is a third example. 911's called, somebody's very serious, they're having a stroke or heart attack. Typically, the Georgetown would have ALS providers that would do the entire transport and response for those patients. Occasionally, there's not paramedics on board or they need more help, then MC1 is then contacted. Another advanced ALS service that would help and with the response. Patients transported typically to Mid-Coast, and then the insurance company gets billed by Georgetown for whatever level of service there is that's provided. All right, so this will work by the patient's insurance company information then will need to be obtained and recorded by Georgetown Fire Department to help with the billing. Usually this is done in the emergency department because the hospital obviously needs all this information. So typically the EMTs would then get the information from the emergency department, and sometimes they may have to collect it on their own if for some reason that they don't have all the information there. So this is really an important concept. Only the patient's insurance company will be billed, not the patient themselves. So what happens in most situations, not in Georgetown, but in other towns, is the patient's insurance company gets billed, they pay for some portion of it, and then the patient gets secondary billing, which means they have to pay the portion of the bill that's not paid. So in Georgetown, that would not happen. There would be no secondary billing of the patient for the remainder of what the insurance doesn't pay. And people who do not have insurance, there are some people like that who don't have insurance, they would not be billed. Georgetown would not generate a bill for them. So again, there should never be a bill sent to the patient from our town, from our services. And if the patient inadvertently gets a bill, I put an asterisk here because that has to be determined. They would then presumably either call the town office or call the fire department directly to try to help work that out. And the details have to be worked out in this. But that would be the concept, would be that they would not get a second bill.
Okay, Gert, I know I said that. I'm afraid I'll forget this question. So can I go ahead and just ask you a question now? So if somebody is on main care?
Yep.
Will main care get billed?
Main care gets billed, it's a slide further.
Okay,
United,
go ahead.
everybody, every insurance company would be.
Okay,
would be
so
billed.
okay, great, thank you.
So there's some background here. Georgetown, the fire department typically responds to about 175 calls a year, of which not all of those are brought to the hospital. 110 of them are, all right? And this is just because of my experience in Massachusetts, maybe a little bit different here in Maine, but typically BLS runs, which is sort of the lowest level, then there's intermediates, more advanced, and then ALS is even billed at a higher rate. But typically the lowest rate is billed at about $2,500 per run. Now, that's a little bit of fake number because most insurances don't pay that. Higher levels of service obviously would build at a higher rate. So in addition, what people often don't realize is that there's mileage involved too. So the insurance companies will pay $50 a mile down there typically. And it's about 15 miles to Mid-Coast from here. So those are that's all income generated from these runs. Maybe the cost is a little bit lower in Maine. I don't know that. We'll find that out. So the insurance company will need to be billed. And billing is a specialty. I don't in any way advocate that Mary or someone in town decide to do this here. It really is a specialty. So there are lots of towns around that do this, and Georgetown could probably find someone for 100+ bills a year. I think it would be pretty straightforward to have somebody to find somebody to do this. And the billing charges are typically for small services like us, 8 to 10% of collections. So if there's $1,000 generated, then obviously $100 would go to the billing company for their business, for their work in doing this. Georgetown taxpayers currently pay around $350,000 a year to finance the fire department. And my understanding is that there's about between $40,000 and $70,000 of direct donations to the fire department. All right. And everybody would want to know how much money Georgetown can make. I don't think it's possible at this point we can estimate it, but to know that exactly for a number of reasons. One is it's going to change year to year depending on the runs that are done, and if it's for visitors in the summer, if it's permanent residents, what type of insurance they have. So again, the $2,500 per the basic run, and the mileage is a gross charge. Most insurances only pay a portion of that, and all insurances pay something for EMS transport, including out-of-state insurance companies, Medicare, Medicaid, which is Maine Health, Aetna, United, Blue Cross Blue Shield. They know that a lot of people get to the hospital by ambulance. Okay. And the benefits of this, that the dollars would go to the town rather than padding the insurance companies, bottom line. And this money, again, this is something that's gonna have to be figured out. Does it go into the general coffers for the town? Does it get put into the, offset the cost for the fire department? That's something that's gonna have to be worked out, but it's money that's not there now. It's money that should come to Georgetown, that most other towns, do the same thing. They bill for the services, okay? All right, and here are some possible issues. When I've talked to different people, these are some of the things that come up. Maybe there's some more work for Georgetown, for the fire department, for EMS, because they would need to verify the insurance company, insurance information. But again, the hospital has this, so typically it's pretty straightforward. Either the hospital would give the demographic information to the provider when they bring the patient to the ER, or maybe it could be faxed to the department later on. We would have to find somebody who does the billing. Again, my suggestion would be to find somebody who does it from one of the other towns, the system around here, and that would probably be the most straightforward. That would have to be done, okay? And this is another one that I heard. People would be afraid to call 911 because they think they're gonna get a bill. Again, only their insurance company should get a bill. This is an issue that's been raised in the past. I think it's one of the reasons that we haven't done this yet. And this is really an education issue, because there should not be any payments expected from the patient. So patients are worried about this. We would have to, as a town, would have to educate them that that's not the plan. And a real concern for this is that it really has nothing to do with billing or this change, but rather there are a fair number of patients who don't want to bother the fire department, or they would be embarrassed if the ambulance shows up and the lights are blinking and the neighbors are looking out the window. This is really universal, why people don't call them. And an unknown is that $40,000 to $70,000 that's donated, maybe that would be lower, maybe it'll stay the same, maybe it'll be lower. People say, oh, they're making money now, so we don't know what's gonna happen there. But it should be, the collection should be substantially more than the loss of what's donated directly. Okay. So again, this is a significant way for Georgetown. The change is the way the fire department typically runs now. Not how it's gonna be run, but how the money would come in. There are multiple steps to getting this implemented, including approval by the board, and it would have to go before the town, the annual town meeting. And I say lots of education, but I'm not sure how much education is gonna need, but it'll have to be done to let patients know that they should not expect a bill from this. All right. And just a summary here. Georgetown should bill insurance companies for patients transported to the hospital by Georgetown Fire Department. The patient should never be directly billed or charged, including no secondary billing. We would need to educate people thoroughly in this, and the bottom line for this really is let's stop subsidizing insurance companies, okay? And I'm open to questions, if you folks have questions, or if you'd open up the audience, whatever you like.
I am figuring out how to stop this share.
And I do have some questions. All right. So I have about 6 questions. Would you like to go first?
You have 6 questions?
Yes, it's looking like
Great.
about that much.
I should have been taking notes, I think.
Well, we might have the same questions.
Yeah, I don't know. I've been reading your presentation and it seems very clear what needs to be done, if we choose to do this. So, no, I think I'm good on questions.
Okay.
Yeah.
And Brian, some of these questions are for you too. So I guess I would start with, how many of our donations for the fire department, if we have that data, are targeted towards ambulance services?
I think that generally our donation from the fire department, we receive, through the GBFD nonprofit, very few of them are targeted in any way at all.
So they're unrestricted.
Basically, yes.
Right.
And we typically have used those fundings historically for, capital funding, for large projects, large purchases, things like that. That's how we have traditionally used those funds.
Okay.
We have had some targeted donations for certain items.
Right.
But that's not the general rule.
Okay. And how much is it now? Are you able to gather how much it is now per run when y'all do transport somebody? And obviously you're not billing insurance.
We can make an estimation.
Yeah.
And it's an estimation because we don't separate our financial, the the finances for fire and EMS separately, so. I can make an estimation based on, what percentage of calls are EMS calls and based on the percentage of total budget, so. That we can easily do, I can get you a per number call if that's needed,
Yeah,
but generally,
But
our.
that's
our-
data you could
Yep.
guesstimate at.
Yeah, it's a reasonable estimation, that the state used when
Okay.
they were doing their funding,
Okay.
models, so,
Okay. It should work
that
for
works for
us.
yeah.
I understand. And how many towns in Saginaw County, again, if we know this information, do not, so I remember at the informational meeting that you first did a few years ago at the GHS. And and you raised this issue, and then the traveling doctor, I think his name is Tim Pay. Okay, Tim Pay addressed us and came up to me, I think I told you this, Brian, afterwards, and said, you're on the select board, how come your town's not doing this? He was nice about it, but kind of like, what's wrong with y'all? And I said, I'm just coming up to speed. I'm sure this is an issue. Brian obviously just, he's got his eye on the issue. And he told me how many towns, I think at that time, but can you tell us how many towns in Saginaw County are not doing this? Town cities are not going this route, Brian, if you know that
Not
information.
billing for ambulance service.
Yeah,
As far as my understanding is, it's only Pittsburgh.
it's only Phippsburg. Okay,
It's only Pittsburgh that I know of statewide, never mind Saginaw County. Almost every other bills at some level, most do full billing, whereas they bill the insurance and then the patient pays the remainder,
okay,
typically.
So
okay.
Pittsburgh and Georgetown.
As
Are
far
the
as I know,
two-
yeah, for now,
Okay.
yeah.
And Tim Pay if you don't know him, he used to be in the volunteer here, and he's now.
Yes,
He's now a physician. He's actually the EMS medical director for one of the regions in the area.
For our
And
region.
yeah, and he
And I-
drives around in his little, and it's
Yeah.
not his SUV, I've seen him
Yeah.
drive around, okay, yeah,
And I talked to him about this, and he's very, very supportive,
yes.
so.
I got that from his message to me that night. All right, how many towns, Tim Pay? And then, has the board addressed this since your informational meeting a couple of years ago, your your volunteer fire or the auxiliary board, or maybe now it's a combination of the two, because I know there's been a transition over the last 3 or 4 years since it came in under the municipal umbrella.
So before I became the chief, well, I was involved with Georgetown, it had been discussed at the Georgetown Board of Directors at one point. That was probably 5 years ago at least.
Okay.
So it had been discussed at that point in time. We looked into it lightly at the time.
Yeah,
And at the time decided that it was too big of a change to take on at that time.
sure,
For us internally anyway, we didn't have the mechanisms for it. And so, and also at that point, we were looking into possibly having the funding go directly back to the fire department to directly support the operations.
right,
Rather than possibly going back to the town. Since then, though, the finances for the fire department have completely changed.
Right.
Really kind of swapped around
right,
in terms of who's funding the majority of the department and their
Right.
operations.
Right.
So that being said, we did talk about it then, but it's a completely different conversation now.
sure, sure. And then I guess this would be just something to put out in the world. I wonder if we have, and I agree, it does make sense, just like we share an animal control officer, and we share, services now, as a fire department with other jurisdictions. But I just wonder if we weren't able to tack on to another town, Rouseck, Woolwich, something like that for the billing. If we have a town volunteer that has performed this kind of billing in the past, this kind of work. We have a lot of people resources in this town. And so that would be something that I think would be worthwhile if we decide to move forward to really scour Georgetown to see if we have a people resource to help us launch this program, should we move down that road.
I mean, it's a possibility for sure.
Yeah.
From my experience and my knowledge so far, and I don't know nearly as much about the billing aspect as other aspects.
Sure,
But that being said, it does take specialized knowledge and understanding
right,
of EMS, how the services
Right.
work, how the billing system works, what goes into the calls. I mean, each things are billed separately sometimes. So the amount of knowledge there behind it can be a bit extensive. So it would be preferable to have someone inside the department who understands the calls and how they work
right,
to be doing that. And I know that, for example, Topsom was doing it internally for a while. They've now since outsourced that. But they had one person working about 12 hours a week, every week. And granted, they have many more runs than we do. They're doing about 2,300 runs a year, so, that's total calls, but still significantly more than us. So is it possible? Yes.
That we could, have a volunteer, a new volunteer to the department who has medical billing.
If someone had that kind of background already. that
Right,
would be
that's what I'm
possible.
saying.
Yeah.
And then they agreed to volunteer because they have, signed on with this as a worthwhile use of their time to help support the, I'm just sort of thinking this through. Yeah.
I
Okay.
think they would need to have experience with medical billing.
I agree. That's the only kind of,
In Massachusetts, when I first started, there were a number of towns that did like mom and pop, or they
Right.
did internally, and they've all gone away from that.
Yeah, no,
It's
I-
just too complicated.
no, it's just like with budgeting, it's great. It's really important to have somebody who's got budgeting, financial management, those kinds of experience when you're looking at those kinds of things. And I would say the same would be for medical billing. So, okay, great. That's all my questions.
We do have a few in the chat. Do we
Yeah,
wanna-
let's do it.
So Jeff Birdsell asks, will the fire department lose its tax exempt status if they switched towards billing?
So at this point, there's two entities. There's the Georgetown Fire Department, which is essentially a municipal department at this point in time. The town pays for all the operating costs, payroll, equipment, maintenance, fuel, all the things going to making the department run every day. There's then the Georgetown Volunteer Fire Department 501(c)(3) nonprofit entity. That is the GVFD that everyone writes their donation checks to. And the GVFD uses that funding to supplant the town funding as it is now, for the purchases that we do. So if the GVFD was the one who was actually doing the tax thing, I think that would be an issue that we'd have to work through. But as far as I understand it, it would be the town doing the billing at this point, and that's a separate entity. So I don't think so in that case.
All right, and Terry Taylor asks, and notes he's the FAC member assigned to the fire department. Seriously consider any revenues be directed to reserve funds for capital expenditures. It's more of a thought, and he shares that the equipment replacement costs are at a huge cost, quickly approaching.
In that case, Terry is absolutely right. We do have some very large costs upcoming in the next several years. And if we did do ambulance billing, the revenues from that would help offset any costs, we think, and be up to the select board and the town members to how you guys want to apply them and where to put them, so.
Yeah.
And Bob Trebona asks, on average, how much does it cost in hours and money to submit a bill?
I don't know that offhand.
Gert,
I'm not sure that's really relevant, because what they do is they charge at 8 or 10%. So if they're
Right.
good at it, it takes them an hour. If they're, have to do extra work, it's all included in that cost.
I mean, and possibly from Bob's question is, if it would take us extra time to submit that, it would be a little extra work on our end on a day-to-day operation level, just to make sure that we were sending the completed run report with all the information to the billing company. And we would do our own little checks on that first to make sure they had the information they need to then complete the process. So it'd be a little bit more for us, but I don't think it'd be a huge amount.
How do you feel about acquiring all of the insurance information from the emergency departments?
Simple process because everybody else already does it.
Right.
So their end, they're already set up to do it.
Yeah.
We walk in the door, we first we speak to his registration,
right,
they get the patient info, check them in. And then before we leave, they are standing there with a face sheet, just all the patient's demographic and insurance information, which and every other service I've worked for, we then attach to their run sheet. When that's completed, the billing company goes in on the back end and reads that info there. That being said, if the patient has never been to Maidstone Hospital, say, they won't have their information initially, but they'll get it later.
Mhm.
And the billing company will be able to access that later by the time they get to it. So. Us verifying information is much less of an issue, and that would be something that happens on their end, and there might be people that it's hard to get that information from, but that's a small portion of it, I imagine.
Lisa Sabatine asked that Gert mentioned a secondary insurance policy would not be billed, only a primary. What percentage of the cost of a run would then still fall on the town of Georgetown?
So maybe I wasn't clear in this. The whole goal of this is that the patient would not get secondarily billed, and Brian can speak more to this. The only time Georgetown may get a bill is if there's another ambulance service that helps out. And then if they bill the patient, and that, I mean, they would sometimes bill the patient directly, but I think. And that's happened in other towns where I've worked with, that there is an understanding between Georgetown and Bath maybe, and then if Bath helps out, then maybe there's some prorated charge or something like that, that Georgetown doesn't get the entire initial bill, because again, nobody really gets that, the insurance companies don't pay for that either. And then,
Well, hang on, so is there anything you wanna add to that, Brian, cause you were gesturing?
Yeah, just, I think, who was answering?
Was
that one?
Lisa said.
So Lisa's question, the insurance companies, every insurance company is gonna pay, they pay similar rates, I believe, is my understanding, but not always exactly the same, depending on if it's Medicare or if it's private insurance, or it could be depending on the patient's coverage, things like that. So it would be based on what the charges actually are, and those are numbers that we can set. There's, universal, but average costs that more departments are not charged for. We can set whatever rates we get. Typically it'll be a percentage paid by the insurance. I feel like someone told me 60 back in the day, 65, 70 maybe, of the charge. But even then, the charge itself doesn't always cover the full cost of the call itself. So it's a percentage, and but it will vary depending on the call, depending on the coverage and the insurance thing like that. There's so many variables, it's hard to say exactly the number.
and I would encourage the town not to say, well, we just started this, so we'll just, we'll charge. I'm making the numbers up totally, but for this run, we'll charge $2,000 when everybody else charges $3,000. There's no benefit to Georgetown at all for that, and there's no cost to the patient. So I think the charges should be what is.
The prevailing rate,
And I think that with this question too, I guess,
which question are you referring
I'm
to?
sorry, the one that says secondary insurance,
Yes, go ahead.
primary. So I'm not, I don't think that's quite how I addressed it. What it is whatever the patient's primary or insurance is, they would be the one billed. And then if there's a secondary insurance that's gonna pay, great, pays Georgetown some more money. But the rest of the bill, that's again, making numbers up, if it's $2,000, insurance pays $1,200, the patient would not get the $800. It would not get the bill for that $800. Okay, so.
And would the town get the bill for that $800? No.
No,
Brian
because
is saying that.
the town's the one generating the bill.
Okay, I think that was the
So,
question.
okay, so.
I think that was the.
Okay,
The $2,000 would go to the insurance company pays $1,200, there's a remainder $800. What often happens is that $800 gets sent to the patient, and the patient has to pay. Georgetown would not do that.
okay, Georgetown would not send
They
it to
would
the
not do
patient.
that secondary billing,
So
not
that's-
secondary insurance, it's secondary billing, I think
Yeah.
that's what it.
And that would ultimately be a decision of the board and the town. They could choose to send it on, but
Mhm.
in your proposal, they would not.
Well, I think. Yes, I mean, doing my background research in this, this has come up before with Brian, and I think even before that. And whatever the reasons are, the town has said no. So this is a major step in saying yes. The town could secondary bill other towns around, but I think we're gonna run into other issues if that happens.
Absolutely.
And it would be harder to pass, I think, for the town to say, all right, we're gonna charge like all the other towns. If there's no cost to the patients, I think it would be certainly a major step forward. And could be maybe an incremental step, but that's not at this point.
Okay.
And Bob Trebona asks, and I believe you already answered this in the presentation, that it's too early to tell, but he asks, if we went down this road after paying the administrative costs, what would we expect to be paid as a town?
I think it's totally a guess at this point. Maine Health, Medicaid's gonna pay much less than United. A few instances of somebody's, traveling from Arizona and has an insurance company there, and they use the Georgetown Fire Department service here. Occasionally they pay the entire bill, but that's by far the exception. So it's just really hard to estimate. And if we come up with a number for 26 or 27, 28 is gonna be different, because it's gonna be different runs, different insurance patients, different insurance companies.
It seems to me that, again, if we go the next step down this road, we could, and I'm just throwing this out there, you can tell me if this is true. We could bring Tim Pay in, and maybe they have a little bit more of these statistics, these data points for us, about some of these costs. In other words, to Bob's question, what would we expect the town to be paid? We don't know. We're speculating at this point. I don't know if he'd have any more specific data based on his experience in doing it so far. But that's where I'm just wondering out
Well,
loud.
I think it's gonna be, we can give a guesstimate like you had said, and it's just, we're not gonna come up with a definite number. Because of all the different kinds of insurance companies,
Right.
different kind of
Okay,
actual ambulance runs too, a sprained ankle is gonna get billed differently than somebody who's having a stroke.
sure.
I think that
That's a really good point. Go ahead.
to possibly, to get that kind of information, we'd have to, I think the best way to go about it is to solicit the billing companies themselves and.
Yeah,
Which we would have to do anyway to find out who's gonna work for us, that kind of
Right.
thing. They'll be able to give us a much better estimation, which I imagine they're doing internally to find out if it's worth taking someone as a client,
right.
to make it worth their while.
That's
So,
true. Okay, excellent point.
Mike McDermott asks that if I have a high deductible insurance plan, if I'm a patient and my insurance company passes the entire cost to me, will the town pick up the cost with this proposal?
That's a great insurance plan.
I'd say in that case, the town would pick up the cost, just as they're doing right now, picking up 100% of the cost.
Right,
It would, if your
Yeah.
insurance says we're not paying anything, That-
we wouldn't be in
we're not
that,
picking up the cost, it's just the cost.
well, but we would also be paying for the billing company, the 10%.
That's true. Well, they're only getting 10% of the revenues.
Yeah.
Generated,
Only paid.
Possibly. We don't know that.
we don't know
We
that.
don't know if it's 10% of what's being billed.
Yep.
Meaning, if it's billed at 2,000, they
Right.
get $200. And if it comes into us at, 1,200, we're paying out the $200, you know what I mean?
The,
So there are some still variables that we don't have any idea on.
well, that could be a point of negotiation for us with the billing
Absolutely.
companies.
I did
Right.
speak to one billing company last year who solicited us, they were a new company starting out, and so they contacted us. I met with them, and they take their 10% from what they are paid,
The
in that
revenue.
case.
And that's.
Which would be
actually-
fun.
Yeah, and that's
Yeah.
typically how it's done, because it's their incentive to bill correctly. They shouldn't do fraud and bill extra. But if they're not accounting for all the little things, the IVs or whatever, they're generating less of a bill, they're getting less money too. So their incentive is to do it correctly and kind of maximize it, but not do excess because that's fraud.
Yeah.
And I think in this example, the high deductible, it's the same as somebody who doesn't have insurance.
You said it's, in Mike's example, if the high deductible insured person be the same result, outcome as somebody who has no insurance.
Basically.
For the town.
Yeah.
Okay, just making sure I hear you. And then we've got Lisa. In the past, we've always heard the argument that we do not want people who need an ambulance to hesitate to call, given the cost. If as Gert reports, the patient will never receive a bill, why wouldn't we do this? And so she asked that question. Somebody's got a thumbs up to that.
I agree.
That's a rhetorical question, but anyone can answer it. Okay,
And that is all of the chats.
that's it for the chats. Okay, great.
Seems like next steps is talking to some billing
Yeah.
agencies and getting a little more information.
Sure, yeah. Yeah, go ahead.
I have a question. So if this is potentially on the next town meeting, the agenda, what does a select board have to do? And then besides, solicit billing companies, is it really, haven't been in town long enough to know
Yeah,
what the process is here.
well, we expect to see you regardless of what's on the town meeting warrant at the town meeting, teasing. But there would be some steps, and obviously we'd look to Brian to help guide those with, in terms of the billing companies, who you've already met with, Brian, what your thoughts are. And I don't wanna put you on the spot tonight about what your thoughts are, but we definitely wanna hear from you and the fire department team about your reaction to this proposal and what y'all think are next steps, and then we definitely need to assess those and what makes sense to see if it would be ready for a public hearing and then go to town meeting. What do you say?
Along those lines, I think we'd wanna hear from the fire department. We probably would wanna bring in for a presentation to this board, maybe jointly with your board, from the billing, so we can ask some of those similar questions, let the public weigh in as well. We've got plenty of time for the town meeting warrant, that doesn't need to be posted till 7 to 10 days before the June date, so we have some time. I think during budget process this year, if this is the direction folks are going, we might wanna raise that in those conversations, that we're looking at possible revenues. As Terry talked about with reserve funds,
Yeah,
we may need to use existing ones, or is there a new reserve fund with a definition that has to be set up? So I think there are a lot of logistical questions that we can work through.
and Brian, Gert, would you be available as a, to help, I mean, it sounds like
Yeah.
it, but I just wanna make sure, putting you on the spot. And town meeting is June 13th, I think.
Yes.
Okay, so to give you a sense of that, you know, I was joking about coming to town meeting, but we do want you to town meeting.
My first one was 6 hours long, just saying.
Um,
Historically, Mary, we're along this kind of move, what other steps might we be missing on approaches?
Nothing,
Okay.
other than education.
education, yeah. I, you know, I love what y'all did a few years ago for the informational meeting. I think it's an important way to reach people, record it like we did, and like, you know, other groups have done, conservation, other programs at GHS, and that allows folks who might miss this, another informational meeting leading up to, you know, if we decide to go forward, leading up to a public hearing, they'll be able to get their questions answered and don't feel left in the dark or misunderstanding or running up against the same question we've all had, which is, will people not call because they're concerned?
Brian can tell you it's happening now, but not because of
Right.
this issue, and it shouldn't happen because of this issue.
Right.
Uh,
Okay,
And I'd advocate for the education part to be done beforehand, so people really understand what
Yes.
this is, so that the town meeting is like,
right. 100%, I think that would be necessary, just so they have a good understanding. This was helpful to us, it was helpful to be able to ask questions.
And thank you, Katie and Gert, for helping get this
Yes.
to our level.
Yes,
Gert approached me, yeah, it's great.
thank you both.
thank you.
And thank you, Brian, and all the firefighters who are out there and EMT and here as well. We appreciate y'all turning out and listening and contributing quietly. All right, thanks again.
Thank you.
We'll be in touch. Brian, you've got an update, so you're not going anywhere, right? All right, let me pull up my agenda and get the.
I do have.
Okay, good. I've got my questions here. So we are ready. Next, a minute for the minutes to review and entertain any motions regarding the December 9 minutes.
Yep, I moved to approve the December 9th minutes,
Okay,
and there were some edits, but I caught those, right?
got
Just
those, yeah.
today.
yep,
Today
it was
was-
today.
Yeah,
Apologize for that.
no. good.
Okay. All right, and I will second that motion. All in favor?
That is unanimous, 2-0.
Great. And then, yes, it looks like we need the municipal valuation return.
Yeah, so just as an update, at our last meeting, we shared that the municipal valuation return would be ready for sign off tonight. I have a copy of the return here, though you almost want to have a assessing class to dive in on some of the technicalities in here. I have copies to be signed off for us to keep on file at the office. Main revenue has shifted to where they only want things digitally now. And so your signatures won't be on file there, but we'll have it here as backup. It was a lot of fun going through that. Mary and I ran through a bunch of numbers today, had a couple of questions to Bill Van Tynen. I will say he thinks one spot on the form is just completely silly, but I digress, but I told him I'd relay that. Talked about the average undeveloped price of an acre, and he goes, well, we have many different depending on the
Right.
neighborhood, so
Right.
Yeah.
I digress. So that is ready for signature at the end of the evening.
Okay, great.
And to dive in if anyone has questions, and if I don't know the answer, my friend Bill will.
Okay, yes. He's an important part of this operation.
Mhm.
All right,
We skipped this, the November
financial, I'm sorry, Mary.
That's
Why I
fine.
need to have my
Don't worry about
glasses on. Okay.
Yeah.
November financials.
I
You
emailed them out to
provide
you
them,
earlier.
that's right, yep.
Yep.
Okay,
If you
great,
have questions, Holly, send my
Okay.
emails in.
okay,
Any questions, concerns,
No,
reach out.
no.
okay, thank you. All right, we've got a boatload of correspondence. Go ahead, Tyler.
Not really, but we did have some funding updates from Senator Angus King
Yes.
about grant opportunities. Senator Denise Tepler sent along her email legislative update. I'd flagged that there were a lot of good holiday celebrations info in there locally, so dive in when you get a chance. Maine Emergency Management Agency reached out about the Building Resiliency in Communities, the BRICS program. We had been working with the Friends of Seguin Island Lighthouse Station on a BRICS grant until federally all of those grants went away and were frozen. It now looks like they might be coming back to life, though there's still a lot of if, who, when, how, so I will keep folks apprised. And hopefully we can get some of that federal money to help with the fossils.
Yes, okay.
And there was a funding request from Sweetser. I would note this funding request didn't include all of the items we were hoping.
But it did
They-
address how many Georgetowners, 23,
Yes,
which is helpful.
which is very helpful, and they had not yet gotten the letter from the town. We sent them with the donation check, so they will be getting a supplementary information.
Great.
And there were no continuing items.
All right, Katie, do you wanna, go forward? I mean, we just met
Sure.
last week, so.
Yeah, yesterday morning, the planning board met again in a special meeting discussing the short-term rental ordinance that they've been working on diligently. Another couple hours in, and it's coming along.
Great.
Doing a great job.
Thank you, planning board.
Yep. And, I haven't been to any other things since last week.
Let's see, I think the FAC met yesterday, so I'll make the next meeting, the TOPMB I think met
Today.
today, so I just need to get those on the, those schedules when they come out, that would be helpful, and I don't think any other, solid waste met on the 11th. And, we've got probably some meetings this week, coming up.
School tomorrow.
The school committee's coming up, and I know you put on the agenda who else is coming up, so,
School committee and then
planning board
planning
again.
board, and that's it.
On the
'Cause then
17th.
we're off to the holidays.
Right, okay, yes. All right, great. Have at it, Tyler.
Right, just for a town administrator update, I wanted to note that we have 2 more abatement applications that came in. We will be tackling those at the next meeting in a meeting of the Board of Assessors. They weren't ready for prime time tonight. One of them was specific to an acreage issue. We for years had it assessed at 7 acres. They provided a deed and a survey that shows they're at 5 acres, so that's something that'll be an easy fix. There's also a land valuation one that came in that I'm starting the initial analysis. It's something that may bring in Bill Van Tynen. I'm not sure yet, but those will be ready at the next meeting.
Okay,
I wanted to also flag that we officially have the
Yes.
Peterson appeal date now, coming up in January. Members of the board are more than welcome to attend if you want to.
is that the 22nd?
Yes.
Okay.
And there's a site visit to the property at 9:30 AM, and then we all rendezvous back to the courthouse for 11.
Okay.
Bill Van Tynen will be representing the town. He's already been working on strengthening his case, and so we'll see where that goes. I also wanted to note that steel is now on the ground on Higgins Mountain. The emergency
Yes.
communications tower is up in the air and well on its way. We'll wait to see when that's done, but I know the process of getting the crane up the hill was an adventure, and I'm glad they did.
Thank you for today's picture.
Holiday office closures, just as a reminder, Christmas Eve and Christmas Day, the town office is closed. The transfer station will also be closed on Christmas Eve. On New Year's Eve and New Year's Day, the town office will be closed. The transfer station, however, will be open until 12 PM on New Year's Eve, for what that's worth.
That's important, 12 PM, New
Yeah.
Year's Eve, then it closes.
And then they get to enjoy the rest of the year.
That's very good.
The tennis courts, I just wanted to flag that at our last select board meeting, the board had moved forward with pulling money out of the reserve funds for TOPMB to tackle drainage. I want to thank Kathy Gravino for citing a survey from John Wood that actually showed that the tennis courts were in the Ipcar Preserve, made up part of the boundary. We now have a very clear understanding of where the tennis courts are. It had been, my understanding was on that snake-shaped lot, which it abuts, but it's not quite on. The Conservation Commission has asked that we have the TOPMB do their forest use application, which the TOPMB at their meeting today did by hand, and we've got it sent off to Jess Weller, and so we'll wait to see how that goes.
With the conservation, yes.
Yes,
And, that's something that I explained to a different set of folks that, when there are forms that the town is transitioning to a more systemic process across all committees. So, the TOPMB has always appropriately required a form for the wharf use. And conservation is using it for the lands that are identified in their programs and, including the reserves and IPCAR and those kinds of, behind the school round cove. So that's important for people just to understand now that it's not an arbitrary process, it's across the municipality that forms are being requested and completed. So thanks to the TOPMB for jumping on that and for conservation for its next steps.
and I do want to note that the chairs of the TOPMB and the Conservation Commission, I've spoke to independent of each other to
Right.
say that we might be looking at a possible memorandum of understanding between TOPMB and Conservation, just to clearly delineate some of those responsibilities. Not at a draft stage, but I got positive responses from both that it might be as good. Next week, I just want to flag that we'll be getting a lot of support documents off to Maine Revenue to back up some of the municipal valuation return. And lastly, I just wanted to flag that I had failed to get the select board packet, the last two meetings onto the website. As we'd said for Mondays, I just wanted to let folks know, some of the items in both of those meetings came a little bit behind, so. Anytime anyone has a question for a document, let us know and we can get it,
Yes.
and if it's not on the website, it's not intentional, so.
Right.
I just wanted to flag that, because we really, in the past couple of years, have moved in a very positive direction on increasing transparency.
Yes,
And
well,
that's,
it's a busy office. One other update that you and I talked about is we now have two candidates who have taken out papers for the special election that'll occur on February 17. And so stay tuned to hear more from those candidates. And we did talk the last time about potentially a candidates night, so
yeah,
we'll try to build that into the program if it's still, if the timing works. Especially with the moderator and the candidates, so thank you for that.
thank you.
All right, Mary, we're ready for the,
Okay, mine's just a
Financing.
brief one too. The tax anticipation note that we spent a lot of time preparing for is not needed.
yes,
We have already notified the bank, I've already notified the bank that we will not be utilizing that. The audit field work, which usually happens in September, happened last week. That field work, there were a couple people down last week. That work is all complete. The tax money is starting to roll in, so I'm already moving that to various banks, looking at interest rates, things like that. And now we're gearing up for the 26-27 budget.
yes,
So FAC met yesterday. I had a doctor appointment, so I was not able to make that meeting. But I'm going through the budget package now and, adding columns and blah, blah, blah. And all the donations and Matt Mahan Island were paid on the last warrant.
okay, yes,
As you know, we wait for the money to,
Right,
the
to
tax
start
money to
coming in,
start
yeah.
coming in. And then, when we were doing the municipal valuation return. Today we found out that the maximum rate is 7.5 for interest. We were doing 8, so we've gone in, which has not become effective yet because nothing's due. So we've gone back in and corrected that in the system, so.
okay,
And I think that was about it. So, yeah,
okay. All right, yes, thanks, Mary.
no problem.
And Brian Whalen, Chief Whalen,
So again, I also have a quick update tonight, where I talked about the big topic for the evening,
Yeah.
but, just a couple little things. We had, a couple weeks ago, we had actually back in November, I believe, we had a little incident with, some batteries in one of our trucks. Actually, the batteries exploded, when the truck was turned on. Luckily, no one was hurt, and we were able to clean up the mess, no problem. Got that taken care of, so that has been dealt with. But in the moment, it was like, oh, that's kind of scary, dangerous, but
do we know why that happened? No,
but the assumption is that they were 18-year-old batteries, first of all, so that's part of it. And
Yeah. In what vehicle?
it was the tanker truck. So it was the big truck batteries. 2 of the 3 of them actually exploded. They can build up hydrogen gas inside of the batteries when the water level gets down low, which because they're so old can
That's what
happen. So we believe that's what happened. They've been replaced, mess has been cleaned up, the old battery's taken care of, so We got all that taken care of, but, yeah, thankfully no one got hurt when it happened,
Yeah.
so that was really fortunate.
That's the
But,
second battery story I've heard recently, where batteries just explode. One was in a house,
Yeah, It,
so people don't
well,
think about that.
right on top of the battery, it says, careful for explosions that can happen, so.
Wow.
Did it
Um,
damage the truck?
It did not, thankfully. The compartment it's in is tucked up underneath the cab. So it made a mess, but it didn't damage anything otherwise.
Thank goodness, y'all,
Yep.
everybody was safe.
Yep,
Wow.
absolutely. So that was good. But on a positive note,
Yeah,
we have, looks like 4 new members looking to join the department right now.
awesome.
I think,
Thank you.
yeah, that's great. Looks like 3 of the 4 were actually, they're getting their initial, state mandated training tonight, right now over at the fire station, so.
Great.
We're starting that process and getting rolled into the regular schedule that everyone else is on for starting January, so.
Wow.
One person looking to go to EMT school, one who's in the EMT class now, looking to be a firefighter, so. Yeah, we're really fortunate to have these people, so.
Look at how well that outreach has
It has
turned.
paid off.
It really has.
In fact, I'm hoping we have enough gear and equipment to give all the new people, their stuff, so. Yeah, it's a good problem to have.
Congratulations.
Thank you.
Job well done, fire department.
Yep, I was also very, very excited, just like you guys were, to see metal up on top of the
Yes.
hill with a new tower. That was great. Very, very happy about that. Can't wait till it's done.
Yeah.
So,
And I saw something from, I think it was Jeff Birdsall that said he thinks that go live on the towers April, May. So I don't know if that's what you're hearing.
yeah, last I heard from, the communication center director that, it was kind of up in the air. Apparently it's hard to get people to climb to the top of a tower in the winter in Maine to put equipment up.
I would do
We
it.
do?
I would do it.
There were a couple guys hanging up there today. It was really cool. I'm like, wow.
Yeah.
Yeah.
Yeah, so,
I mean, if the heights don't bother you,
Yeah.
that
I
sounds
don't
like a
think that's
blast.
full
That
height
could-
either. I don't know how much more they got,
Yeah.
but it's gonna keep going. So, like I said, very exciting for us.
That is.
We had our Christmas holiday event in December. Santa very wonderfully showed up for the kids who were there.
Yes, thank you.
We thank Santa for doing that. That was very nice.
I've heard that the chief was not on the nice list, though. I don't get it.
I know how that happened.
The chief should have been. He brought Santa down.
Amen.
Yes.
So that was it was a nice event. Thank you to the community center for hosting us.
Yeah.
It was a nice space to be in and kind of just relax away from the department. Was kind of nice. So,
Yes. Yeah.
that was great. So, yeah, that now, let's see, we're at 139 total runs for the year, which is actually a little bit below where we've been the last couple of years. So that's great. I'm very
Wow.
happy that our services have not been needed as much.
Yeah.
So that's been good. And you guys were talking about holiday hours. We have no holiday closures coming up. We will be open. So if you guys call, if anyone calls, we're there.
Okay.
New Year's, Christmas. Well, I gotta work Christmas, but
Thank you.
Somebody will show up
somebody will be
Okay.
there.
from the more robust department. Okay, good. And speaking of the community center, we forgot to celebrate their, remark on their dinner on the
Mhm,
10th.
That's right.
Or no, I guess it was the 14th, right? Yeah. Okay, great. All right, thank you, Chief Whalen. We're on to old business.
All
Looks like
right.
We have none, but I want to make sure I'm right about that.
There was no old business. I would note that Lisa pointed out it was
Oh.
Road Commissioner John Collins that helped get the crane up the hill,
Was
so.
that yesterday? I
Yeah.
saw them struggling.
Yeah.
Okay.
Yikes.
Good.
I
But
wasn't in town, no.
the next item is the approval of portions of the budget memorandum.
Okay, yes. And thank you, John Collins and crew for that final push with the crane. All
Thank
right,
you.
we have the budget memo that will come from us as the select board to the committee chairs and the elected appointed officials. So, just keep in mind, after discussions with Tyler and this review by Katie and me, we've changed a little bit of the deadlines, just to give folks a little bit more time. But we want to ensure that you have, you've got a wealth of resources with the town office, our FAC folks, liaisons for the committees that may not have as much financial experience, or want, or could benefit from the additional help. So this indicates all of the assigned FAC folks, and if you're good with this document, then
Then we would want to
yeah,
we'd want to assign who represents on each of the committees during the budget
from
process.
this,
From this select board as the liaison.
okay,
And if need be, because we're spread a little bit thinner.
Yeah,
Mary and I could fill in on
Sure,
any,
yeah.
and then
and when
on,
we bring on our new, I guess,
and on the dates, we just would have to pick between the 16th or the 19th.
right, yep,
Oh,
yep.
got it. Okay.
Let me pull up my version, so I don't have to look on Katie's. All right, but my assumption is that once we have the election and we have our third person, that person can also assist and we can reassign committees too, because I would want to involve that third person.
Absolutely.
Okay,
And maybe we use Mary and Tyler as placeholders for that. third
Sure.
person.
yes.
That's okay with you guys.
Yeah.
Yeah.
And just with the way the budget process will be ending right in March, it'll be
Yeah, pretty
just as the
soon,
person's coming on.
right,
Yes.
yep. Doggone, I'm trying to pull mine up. Okay, I guess I didn't keep.
You wanna
it
look
on
on
this
with
one.
me?
Sure,
Oh,
okay,
you
yeah,
can
either
use
one,
this.
okay.
Yeah.
All right, well,
So the March 9th
Date.
date, initially I had a 5 in, the FAC had chosen, had recommended the second.
oh,
And
okay.
we're comfortable either way, and the 9th works as well on a Monday, gives folks a weekend to come in.
Okay. All right,
That works.
that works, okay,
When it comes to the 19th or the 16th, the 19th was a Thursday, the 16th was earlier in the week, and I just wanna make sure that I'm looking at it.
I thought what this meant was that the FAC's budget was due the 16th, everyone
Oh.
else the 19th.
I was not clear, my apologies, no, the FAC, when they met yesterday, went through the dates.
Okay.
And they were offering some suggestions, though they were very deferential to the select board, and if I'm incorrect, I know Bob will let me know.
so the FAC was proposing the 16th for the draft budgets due to the FAC.
Right,
Um,
and
Which is a Monday.
it was a Monday, and I had said the 19th, which was a Thursday,
Yeah.
so 6 of one,
right,
we just gotta let them know which one.
yeah,
16th is fine with me.
yeah, that's fine with me.
Perfect.
I would say that so Brian and I had this conversation earlier, for those who have a different process and it's not fire department and school committee, I think it's just the school committee. So that process may not be on the same timeline because their meetings, so that would be the only, but obviously we go through that every year. That board will separately review its budget and do its approval at its meeting around that same time, I assume, and you'll be part of
Yeah, I
that
could
process.
ask tomorrow at the.
Oh, sure, yes, you could ask Elaine, okay, yeah, all right,
And the biggest portion being, this is the biggest portion of our budget.
Yeah. The
So,
school,
so to even come to you presenting anything
right,
without presenting the school is useless,
yes.
you know?
So,
But, yeah,
so that's what I'm saying, is like, I think we gotta.
Yeah.
Just work with
sure,
their time frame
absolutely.
and Elaine, but Katie can do that as the
Yep.
liaison.
Yeah.
Okay, and then the March,
And then again, you've got like June 13 town meeting, and we kind of work our way back. The June 9th is the Tuesday before, so that'd be when we'd have our regular election of all the town officials.
Mhm.
The warrant has to be posted 7 to 10 business days beforehand. So that's pretty straightforward. I did talk with the school, not about if that was the date they'd set the hearings, but all of these dates. The town budget hearing, the school budget hearing, and the ordinance hearing were dates that they've agreed to keep open for us so we can use their facility.
great, thank you. Okay,
So if we keep the 16th, the rest of those dates are good to go?
I think so. The only date that we missed in here, and we'll have to build that in, and we would need the school again, I think, is the candidates night.
Right.
So,
Which
but,
would
but,
be
yeah,
prior to.
it would be prior, be sometime, in May, towards the end of May.
Yeah, we'll build that in when we get closer. I think these dates, we just wanted to really
Yep,
get us your ordinance by this date.
Yeah.
and I won't officially say that if someone gets it late, we'll still take it.
sure,
We usually target a little bit earlier, knowing that there are some stragglers.
right, and we'll have to obviously plug in the hearings
Yeah.
prior to the ordinances. Or, within that process, I guess I should say, but certainly prior to town meeting, okay.
The
These
dates look fine.
These
to me.
dates look fine to me too.
All right, so then we'd wanna jump to the third page. And we'd wanna pick who the liaison would be for the Saginaw County budget.
Yeah,
Saginaw County.
And I'm kind of the gatherer of facts up
Yeah.
front
Yeah.
anyway,
so,
so
if you want a placeholder and just, you can keep me in the loop or keep us in the loop, I'm fine with, I mean, that works for me.
Yeah.
Is that comfortable for you?
That works for me. When it comes to salaries and stipends, and at any point, Mary, if I'm incorrect, let me
Right.
know.
The finance advisory committee is gonna look to you folks to set whether or not you're gonna set a COLA rate or
Yes.
what it is.
Right,
They'd like to have that probably mid-February at the latest.
yeah.
I
Again.
saw the COLA rate, but I don't know what that is. What is
The
that?
cost of living adjustment rate, yep,
Oh,
so,
okay.
and you know, it's often anywhere, depends, it can be
And
high.
I haven't looked, to be honest with you, Ari, to see what it, I
What the-
haven't looked online yet. to
I
see what
know.
it is, so,
I think it's,
Um,
I came across my desk, but, I think it's no, I don't wanna
Okay.
misremember, but you know, it's
Okay.
around usually 3%, sometimes 2.5.
Yeah,
You know, in the past, I think we've done, one year we did a 6% COLA,
Right.
or y'all did before I was on the select board, I think they did a 6% COLA.
yeah, it was
So
2%, it was 2% last year.
it was 2% last
That's what we
year,
did last
yeah,
year.
so,
and the
Mm.
minimum wage was another thing to take into account.
Right,
yeah,
That's
yeah,
changing.
yeah,
yeah. The minimum wage is going up
Yeah.
effective Jan 1.
Yeah.
Okay,
It does not affect any.
it doesn't.
yeah, it doesn't affect any.
Okay.
The only
Everyone's
one it
above.
really affects is your election workers.
Yeah,
'Cause they're
Okay.
paid,
right,
Okay.
right,
but it doesn't affect any fire department personnel.
Yeah.
Any transfer
No
station personnel,
transfer,
any
okay.
town hall stuff.
In terms of the school committee, Lisa is going to be the FAC rep. Would it make sense to keep Katie on as? the
I think it
school?
does,
Yeah,
for
Yeah.
school rep,
who did we decide for salaries and stipends?
That is the full select board.
yeah, that's all
Oh, that's
of us, yeah.
Okay,
In terms of town government and office, Bob would represent the FAC.
And I'll handle that with
Perfect.
y'all. And I can take, BOA, cause that's one of my liaisons,
Perfect.
I could do CEO.
okay?
Yeah.
All right.
And realize that a
Fire
lot of these
department?
don't need a whole lot,
Yeah,
Yeah.
you know?
right, yeah, I could do fire department,
And you wanna keep planning board too?
sure. Cemetery is also mine.
Okay. I can take, the next,
So Katie's gonna do from
Cemetery.
CEO to cemetery?
yeah,
Yes.
All right.
and for now, put me down from conservation, cause these are all my committees. I'll pick up TOPMB while we have our vacancy,
All
Want
right.
me to take solid waste? Cause that's 1, 2, 3, 4, 5, 6.
yeah,
You
you
don't
wanna, we can, I mean, that's one of my committees, so I can take that or TOPMB, if you wanna take either one of those. I don't care, whichever
Okay.
one you prefer,
I could take solid waste.
okay, then I'll take TOPMB,
All right, so just to be clear, conservation, harbor, shellfish and rec are Aria.
yep,
Solid waste is gonna be Katie.
yep, I'll take TOPMB.
TOPMP is there, ACO,
Who is our ACO?
We share one,
right
With
now.
City of Anna.
And it's really, they're
That's a-
more of an on-call.
Right, yeah.
They don't like us to say share, cause they don't, it's just they're stepping up, cause no one else has.
Yeah.
yeah,
And
okay.
we've been
I-
trying for a year and a half now to
Yeah.
find one.
Yeah, so
I've been trying to recruit, don't get me wrong.
Right. Oh, anytime we have somebody coming in, it's like, hey, would you like a job?
Right.
Raise your right hand.
You like animals?
I'm happy to do that with Bob, I'm sure he's got it under control.
Okay,
And libraries and social services, the social services are typically the donations,
okay.
so just for what that's worth.
I'm happy to take that.
Perfect.
You wanna do the road commissioner or you want me?
Sure.
I mean, we're gonna
John
mix
knows
this
what
up a
he's
little bit,
doing.
yeah, okay. Okay, that's it. So it would be helpful, of course, to us if y'all would please, make certain to let us know when, or let Tyler know when your meetings are, and then we can, make sure to put that in our calendars,
Absolutely.
meaning Katie and me.
Yeah.
Yeah.
That would be
that'd
very helpful, yeah.
And so, just for the minute's sake, do we wanna make a motion to approve as amended, or do we just wanna say there was consensus reached on the memo?
There's consensus reached.
Perfect.
Do we need to-
Consensus.
Okay. I don't think it requires a motion under
It-
Robert's rules.
It would not, so we're good to go. I just wanted to make sure we reflect that consensus was there. Next,
We don't have a pen. We
Yeah.
have a lot of technology. but we don't have a pen, so we're gonna rely on your pen.
I'll make a photocopy of this
Thank
too.
you.
Thank,
And Mary will be getting this on out with the budget sheets to the different committees and then
Great.
it's off to the races.
Okay. Great, thank you both.
And with that.
yeah, I moved, oh, public.
Yes.
Thought we were
All right,
talking.
we are back to public comment. Do we have any in the building? No, y'all are a quiet bunch. You just like to get lively before the meetings, right? Okay. And how about in the Zoom world? Any public comment? All right, well, with that, we don't have an executive session tonight. And with that, I'll entertain a motion to adjourn.
I moved to adjourn at 7:06.
Okay, great. And I'll second that motion. All in favor?
Perfect.
Thank you, everyone. Happy holidays. Enjoy Hanukkah this week and next week, Christmas and all the holidays you may celebrate. We'll see you in the new year.